Hi, in this video, I'm going to tell you about important structures of breast or mammary gland that would be helpful in surgery. After this, I'm going to make a series of videos consisting of several parts of breast to cover different aspects that are helpful in surgery. So don't forget to subscribe my channel for more videos. So now coming back to our main topic, I'm going to tell you about some gross anatomy of the breast, and I'm just going to discuss the major structures. So starting from outside toward the inside, first there is skin, the areola, the ampulla, the lactiferous sinuses, the lactiferous ducts, the acini. Then by fibrous breast septa and intermittent fats, the pectoralis fascia, or this also known as superficial fascia of the pectoralis major muscle, the Cooper's ligaments or the suspensory ligaments, the pectoralis major muscle attached to the clavicle above, the pectoralis minor muscles, the ribs, and the intermittent intercostal muscles. So now I am going to tell you about some important points to remember for breast anatomy and its major structures. Breast is the protrudent part of the human breast and is the modified sweat gland. It is overlying second to sixth rib, including the intercostal spaces. Extension is from lateral border of the sternum to the anterior axillary line. The mammary tissue extension is important for mastectomy as you want to remove all the mammary tissue. So a thin line of mammary tissue extends above to the clavicle and below to the 7th or 8th ribs. And from the midline to the edge of the latissimus dorsi posteriorly. So this is very important to know. Then we come to the axillary tail. It is also important for surgical purpose. It is palpable in normal subjects, premenstrually, and during lactation. It can be mistaken for enlarged lymph nodes or a lipoma. Coming towards the lobules, that is the basic structural unit of the breast, most numerous in young women. These are 10 to 100 lobules that then divide into ductules, then go to lactiferous ducts, and these lactiferous ducts contain contractile myoepithelial lining. These are 15 to 20 in number, and they terminate into the terminal ampulla, that is the reservoir for milk or abnormal discharges. After this, I am going to tell you about the ligament of Cooper. It is a hollow conical projection of fibrous tissue filled with breast tissue. Apices of cones are attached to the superficial fascia and the overlying skin of the breast. The dimpling of the overlying skin may be depicting of a carcinoma, and this is due to the ligament of Cooper. Areola. Areola is contains the involuntary muscles that may be concentric and radial in subcutaneous tissue. It is dark in color, and it is very pigmented, and the pigmentation increases during pregnancy and lactation. These contain sweat glands and sebaceous glands. When the sebaceous glands enlarge during pregnancy, these are called as Montgomery's tubercles. The sebaceous glands that enlarge during pregnancy are important for the lubrication during lactation and preventing it from cracks and nipple dryness. Nipple. Nipple is an erectile structure and points outwards. Its apex contains the orifice for the lactiferous ducts, thick skin with corrugations, and smooth muscle fibers that are concentric and longitudinal. Coming towards the most important part of the breast anatomy, the lymphatics of the breast through which the carcinoma spreads. So it's divided into two main parts, that is axillary lymph nodes and the internal mammary lymph nodes. The axillary lymph nodes are greater in number and constitute of 85%. These are further divided into many subgroups. These are lateral, anterior, posterior, central, interpectoral, and apical. The lateral group of axillary lymph nodes lie along the axillary vein. The anterior lie along the lateral thoracic vessels. The posterior lie along the subcapsular vessels. The central pair or group of axillary lymph nodes are embedded in fat. The interpectoral are present between pectoralis major and pectoralis minor muscle. The apical group of axillary lymph nodes are present along the pectoralis minor tendon. These drain into supraclavicular lymph nodes that drain into subclavian lymph trunk that can drain into great veins directly or via jugular trunk or thoracic duct. The lateral group of lymph nodes also drain into the apical nodes. The internal memory or intermemory lymph nodes are fewer in number. They drain the posterior third of the breast, lie along the internal memory vessels, and they are not dissected routinely. However, they were once biopsied for the accurate diagnosis of the carcinoma breast, but it is obsolete now and it is not used. The axillary lymph nodes are the most important used right now. Now coming towards the sentinel nodes. What is a sentinel node? A sentinel node is the first lymph node draining the tumor bearing area of the breast. It is very important because it is used for the staging of the breast carcinoma with sentinel node biopsy or sentinel lymph node biopsy. So for the confirmation of the diagnosis, we biopsy the sentinel nodes, and then we can confirm our diagnosis for CA breast, whether it is carcinoma, malignant or benign condition. So this was all about some major important points about the gross anatomy of the breast or the mammary gland. So the next topic I'm going to be discussing is about the most important investigations used for diagnosing benign breast diseases or carcinoma of the breast. So in part 2, I'm going to discuss that. So if you want to see that, you can, and I'll post it very soon. So I hope it helps you a lot. Thank you so much. Don't forget to subscribe my channel and like the video.